Good morning. This is Dr. McDaniel. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. And today I thought I would just take a couple of minutes to go over a discussion I had with a patient about 3 days ago here in the office. And that's because I realize we have so many types of testing and studies that we do in medicine nowadays, and it's easy to kind of take them for granted and to put them off. And I've been seeing a trend probably since a little bit before the whole pandemic. It got a little worse during the pandemic because a lot of people put off a lot of testing and studies and treatments that they were supposed to do, and it's still kind of the aftermath of that is still going on. And that's when an abnormal report is given, the urgency with which I say woman because I'm a gynecologist, everybody's a she for me, the urgency with which she does the follow-up. I saw a patient just yesterday who I had done a colposcopy biopsy for precancerous changes 3 months ago, and I had to send her 2 reminders that her report was abnormal. She has very, very severe precancerous changes, high-grade changes, and she needs a treatment because that can easily turn into cervical cancer. It took her 3 months to return to the office because she literally told me she had forgotten. I don't know how you could forget that you had a whole biopsy evaluation for precancerous changes, but she said she had forgotten, and she thanked me for sending her the messages. But I had actually sent her 2 reminders. First of all, before the procedure, I tell everyone, please schedule before you leave or call at the outside once you know your own personal schedule. Follow up in 2 weeks to go over the reports of the colposcopy, which is a biopsy, a diagnostic test for precancerous changes. She didn't do it. I sent her a message through our portal system about 6 or 7 weeks after she had not returned. I didn't get a response, and then I sent her another message 2 weeks ago, and she's scheduled to come in. She said she'd forgotten. And then I saw another patient about a month ago. She's a new patient. She told me she'd had a mammogram done in early 2020. Actually, it wasn't early 2020. I saw her in April, and her mammogram was done in June of last year. And they had told her to follow up for additional testing because she had dense breast, and they apparently thought there was maybe some nodularity in one of her breasts. What she told me was that she'd had the mammogram in June. They wanted her to follow up, but she couldn't remember why. And since it was almost a year, could she just get a referral to just do another mammogram? Well, I didn't have her mammogram report since I hadn't ordered it, and she was new. And I said, okay, that makes sense. So I gave her another mammogram report. She scheduled it at the same facility, and they said, no, we need to do the follow-up from last year. So then I had to get the whole report so I would know what I was ordering for her. She finally went in and did the additional testing that they had asked for a year ago. She did that 3 weeks ago, and the report came back Monday. Today's Thursday, so the report came back Monday. She has breast cancer. So I think the problem is we're so used to doing lots of testing in society now, and it's very common to have to do follow-up studies and repeat testing and confirmation, and the majority of the time they turn out to be not a big deal. But that's kind of the weight and balance. We do a lot of testing in order to catch the few people who do have a big deal, which means, of course, the bulk of people are not going to have a big deal. But if we don't do a lot of testing, we're not going to be able to drill down to get the few people who have a big deal. And I know that's especially true with mammograms because I would say out of whenever I order just a routine mammogram for someone, their breast exam was normal, it's a routine mammogram, I'm going to say probably 70% maybe 65 to 70% of the time, they're recommended to have an ultrasound, a sonogram done to do additional testing because they have dense breast. And dense breast means the breasts are really thick and firm. I did a presentation on that about a year and a half ago. I'll do another one just as a refresher because a lot of people aren't going to go back a year and a half. So they're recommended to do additional testing, and I would say only about 50% of women do that additional testing. Predominantly because it's a hassle to go back and do more testing, and then I think secondarily because a lot of the insurance plans don't pay for additional testing, so now they have to start paying for a portion of it. It comes out of their deductible or co-insurance, so it just adds fuel to the fire to make one reticent to do additional testing when, sure, the bulk of the time that additional sonogram, ultrasound turns out to be benign, fine, and they tell them come back in a year. And I'm going to say 65 to 70% of the time women are called, that I see, women are called to do the additional testing, and then out of that additional testing, probably only about 10% of the time does it turn out to be they need a biopsy. Maybe 15% of the time they need a biopsy, and then out of the biopsies, maybe 10% of the time does it end up being a problem, precancer or a cancer. But again, that's the price we pay in order to get that small percentage of women who do have a health problem. A lot of women have to be seen in order to rule them out for problems. Similar to the gotta kiss a lot of frogs to meet your prince, right? So I just wanted to send out a reminder because during the pandemic, a lot of people were seen in 2019, did not do their follow-ups in 2020, or they were seen in early 2020, didn't do their follow-ups because things were closed down or shut down, and then they waited until 2021. So it kind of set that mindset that it's okay to wait. Most things aren't a big deal, and that's actually not true. Now, we stayed open during the pandemic, not 5 days a week, but we stayed open 3 days a week to see women for problems that couldn't wait, for urgent issues. And also, the whole time we were open, the 3 days a week, we still got women who just said, I don't care, I'm putting on my mask, I'm doing my distancing, and I'm coming in to get my annual, to get my breast exam, my pelvic exam, my pap smear, to do what they know is right for them. So it really also falls back to you have to prioritize yourself, and you have to be your own best advocate. Because at the end of the day, the only person who's going to care the most about your health and your longevity and your well-being is going to be you. So I hope that's a helpful reminder that when we do all this testing, the recommendation is to do a follow-up, to return, get additional testing, get the information. Please do it. Thank you for joining me at the corner today. This is Dr. McDaniel. Please hit the like, subscribe, the follow buttons. Check out the YouTube channel and the podcast, GYN Corner. We're on all the platforms. And remember to have a great rest of your day. Take care.